I'm Dr. Clifford Bliss with Foot and Ankle Associates of North Texas. I'm here today to talk about Achilles tendonitis. To understand Achilles tendonitis, we have to understand the anatomy of the area. So the Achilles tendon is the tendon that attaches to the back of the heel and connects your calf muscles, the gastrocnemius and the soleus, to the heel. Its main function is to allow you to push off during physical activities. Sometimes during running, you can exceed 12.5 times your body weight from pushing off. So this tendon is a thick elastic band that's meant to support a ton of force through it. Now, it only has so much tensile property to it. So once this tensile property exceeds, you start to get damage to the tendon. This is what's known as Achilles tendonitis. Over time, you can actually build up scar tissue within the tendon itself, which kind of makes the tendon more vulnerable to further injury. So Achilles tendonitis can be broken down into two basic types, insertional and non-insertional. We see both here in the clinic. Insertional Achilles tendonitis, you see more at the back of the heel, where the tendon inserts right onto it. A lot of times this can be accompanied by a bony deformity such as a spur or a bump. Often these patients will present to the clinic with the chief complaint of redness and soreness right over that bump. The other type is non-insertional. This is found a little bit higher up in the tendon, in the, it's called the musculotendinous area. This tends to produce more of a tenderness to the area. Often the patient will present with a lump or a thick mass. Either way, both are different types of tendonitis, and for all intents and purposes, we treat them very similarly. The diagnosis of your tendonitis is made by a physical examination. A lot of times we'll get x-rays with that to see if there is any bony deformity in the area. Once you have been diagnosed with Achilles tendonitis, the treatment is often based on the severity of your symptoms. It could be just as little as resting and icing. A lot of times it involves placing a heel lift in your shoe to reduce some of the strain on the tendon itself. Often it can be physical therapy could be involved. We also use custom orthotics and inserts to correct gait abnormalities, which a lot of times will help the Achilles tendonitis work itself out. Sometimes if it's bad enough, we have to place a patient in a boot or a cast to immobilize the tendon and decrease motion and strain through the area just to allow it time to heal. We also use NSAIDs, such as ibuprofen, or Aleve to reduce the painful symptoms during this period as well. Achilles tendonitis can be avoided with some precautions. So the first thing you want to do prior to any physical activity is warm up. You want a light warm-up period of at least 10 to 15 minutes, a light jog if you're going to be running or playing a sport such as tennis, basketball, soccer, or football. After this, it's important to stretch. Other things you can do, you can get inserts that go in your running shoes. You can make custom orthotics, again, if you've been diagnosed with a gait abnormality such as overpronation, which often helps quite a bit. The other thing is, if you start to have these symptoms, if you start having painful tender symptoms in the back of your Achilles tendon or the back of your ankle, it's important to get that diagnosed and treated very quickly before you start having structural changes such as scar tissue work its way into the tendon itself. This often makes treatment more difficult. So if you find that you're having problems with your Achilles tendon, come see us at Foot and Ankle Associates of North Texas.